Hi, my name is Dr. Rajesh Shah. I am a director of Life Force and would like to talk to you about what to expect in a good homeopathic case interview with a homeopath. Now, people have been going for homeopathic treatment world over and many of them are trying it for the first time. So it will be interesting for you to know what to exactly expect from a homeopath and how would a homeopathic interview run. So let me share with you certain ideas and let me help you prepare for a good homeopathic interview. Well, an interaction or a case interview with a homeopathic doctor is just like any other interview with any other doctor for that matter. However, in addition to the regular medical doctor's interview, when you meet a homeopath, you will have to give some more details about not only about the disease, but will need to give more details about you as a person. That is going to help a homeopath to make a right prescription. So let me just run through major questions that will be asked to you when you meet a good homeopath. Once you settle in a homeopathic chamber, a homeopath is supposed to ask you about everything about your disease. He will ask you about when did your disease start, what is the name of the disease, if there is a diagnosis being made. The doctor will ask you about all the symptoms pertaining to your disease. For example, if you have a case of some skin disease, then the homeopath will ask you about what kind of skin rash do you have, since how long do you have the skin rash, which parts of the body are affected with the skin rash, what is the nature of the skin rash, what are the symptoms such as itching, scaling, bleeding, oozing, pain, etc. of the skin rash that will be asked to you. If it is a case of arthritis or spondylitis, the doctor will ask you about which parts of the body are affected, which joints are affected, what is the nature of your pain, what kind of pain is this, and on top of that, a homeopath will typically ask you about how your symptoms are getting modified or aggravated or ameliorated. For instance, if you are having a joint pain, a homeopath will ask you a series of questions as to when does your pain get better, whether your pain is getting worse by walking or while sitting, while standing, while getting up from the bed, while ascending staircase, while climbing down the staircase, etc. The doctor will ask you all about how does your symptom increase in terms of weather, climate, change of temperature, with certain food, with certain stress factors, and so on. These are called typically modalities where the ameliorating or aggravating factors are being asked in detail. Homeopathy will also ask you about what kind of medications you have been taking for your disease. So, and other than your main disease, a homeopath should ask you about all other diseases that you might be having, even if you are not going to be treated by this homeopath. For example, if you are getting treated for migraine, say, and if you also have some other diseases such as high blood pressure or diabetes or osteoarthritis or cancer, the homeopath is supposed to understand your diseases in totality. So don't think that you need to tell your doctor, you need to tell your homeopath only about one or two diseases that you want to be treated for. So that is all about the diseases that you have, which you will give information to a homeopath. Now there is a next step. Homeopath will particularly ask you would like to know more about you as a person, not just you as a patient. In the sense, he will now ask you about questions which are not related essentially to the disease that you might be having. So here he will ask you about appetite, he will ask you about the kind of food that you crave, the kind of food that you have excessive liking for, or the food that you do not have liking for. For example, your homeopath might be interested to know whether you have liking for chocolates, whether you love ice cream, whether you dislike fruits, whether you have liking for smoking, and so on and so forth. So all these details will be carefully noted by a homeopath. Besides, the doctor will ask you about the amount of drinks or the water or the fluids that you consume in the day. He will ask you about your perspiration, whether you perspire a lot or whether you do not perspire much. He will ask you which parts of the body you perspire, whether you perspire in the palms and soles, whether in the neck or some other parts of the body, and so on. He might even ask you about if your perspiration or sweat has any strong smell or so on. Besides, your homeopath will ask you about your sensitivity to temperature, whether you are more comfortable in cold climate or in warm places. He will ask you about your stools, about bowel motions, he will ask you about the menstruations, he will ask you about the regularity of the menses, etc. Besides, your homeopath will ask you about sleep pattern that you might be having, whether you get good sleep or bad sleep or interrupted sleep, or you tend to wake up frightened from sleep, and so on. On top of that, homeopath is likely to ask you about your dreams. Yes, dreams are paid certain importance in homeopathy, though dreams are not the most important in homeopathic practice, but some clues, especially about your subconscious mind, could be derived with the help of the dreams that you might be seeing, especially more frequently. So homeopath will ask you if you watch or if you see certain dreams more frequently, such as dreams of fire, dreams of falling down from height, dreams of thieves, dreams of water, and so on and so forth. At the next level, homeopath would like to understand you in your life space. In the sense, he will try to understand how you are placed in your life, about your family setup, about the members in the family, about your relationship with your father, mother, husband, wife, brother, sister, and relatives within the family and within the community. Through this channel, the homeopath will try to probably understand how your mindset works, how you are able to relate with everybody, what kind of challenges do you experience in terms of interpersonal relationship, which will bring him to the next very important phase of case taking, that is called as the study of the mind. Because in homeopathy, the totality that we look at is a mix of the mind and the body put together. So in this case, now homeopath will carefully ask you about some of the most important or prominent emotions that you might be having. You would like to know whether you are a mild person, whether you are a kind of irritable person, whether you have certain strong emotions such as anger, irritability, fear, guilt, jealousy, hatred, and so on. You would like to investigate as to in what circumstances do you feel jealous, in what circumstances you feel insecure, in what circumstances you feel fearful, and so on. And he will also ask you how do you react, how do you behave when you have these negative emotions such as anger or fear or insecurity or guilt or hatred or jealousy. And there will be a series of more questions depending on depending on your personality, depending on how you talk, how you share your feelings and your inner aspects of your mind. After that, you will be asked about, like any other doctor, you will be asked about your past history, if you suffered from any major disease in the past. He will ask you about your family history of diseases, such as some major disease like diabetes, high blood pressure, cancer, tuberculosis, autoimmune disease, hormonal disorders, etc. Homeopath will carefully make a note of all the treatments and major medication that you may have taken or consumed in the past for this disease or for some other disease. You would also like to know about what are the current medications that you have been taking. A good homeopath is supposed to have very good working knowledge about all the conventional medicines that you might be taking, because he is the person who is going to guide you next as to what medicines to be consumed, which have to be reduced in dose, and how. So, at this stage it may be said that a good homeopath has to have good knowledge of the conventional medicine and the medicines or the allopathy, the pharmacological the medicines. homeopath at this stage now will have to go through all the medical reports that you may have brought. When you come for a homeopathic interview, please make sure that you bring all your medical reports with you. And when you choose a homeopath, please make sure that your homeopath has an ability to read and understand your medical reports. Because he is supposed to make a very good diagnosis, a clear diagnosis about the disease, without which a good homeopathic prescription is possibly not possible. So, all in all, this interview should go for about, say, good 30 to 45 minutes. Don't expect homeopathic interviews to run for 2 to 3 hours. Some homeopaths, they end up spending a large amount of time, maybe 2 to 4 hours, but that is not the case in urban practice, and that is actually not required. A good homeopathic interview or interaction should be completed within about maximum 40 to 50 minutes, depending on the case. So this is all what you really need to expect when you are preparing yourself for a good homeopathic interview by a good and qualified homeopathic physician. If you have questions, please feel free to communicate with us by email or over the phone. I hope this helps. Thank you so much.